Pranakasha livestream.
Hey folks, it's Matt at Pranakasha Productions, and today we have a special show with Dr. Mickey Brawner, who I happen to know because he happens to be my man doctor, and that's why today we are talking about how to fix a bent dick. So, why are we talking about that? Because, what do you know, it turns out that this particular ailment, otherwise known as Peyronie's disease.
Peyronie's,
okay, is rather common. I guess I read that maybe 10% of guys have it at some point in their life.
That's correct.
Yeah. So, and one day funny thing happened to me in the shower. I was taking a shower, minding my own business, and then I happened to look down and I'm like, what the heck just happened to my dick? And what do you know? There I was. And the funny thing is that I think 2 weeks before that, I had seen a commercial on TV all about it. And they showed a picture of like a carrot that was bent. And then there was a happy couple that was just walking down the street. But then they began talking about this thing. And there was a special pill you're supposed to take that's going to magically fix it. And I thought it was the funniest thing in the world. And then 2 weeks later, what do you know? I happened to come up with the same thing. So I guess the first question is, how does it happen? And I promised my wife that I wouldn't talk about anything about us. So I'm just going to say that, let's just say that I was abducted by aliens and they did all these terrible things to me. And then when I came back, it was bent. So what causes this?
So the cause of Peyronie's, we don't know who it's going to happen to or why it happens.
Okay.
But essentially what happens is you develop a plaque inside of the penis.
Okay.
That as the plaque forms, creates a bend in the penis. We know that it's dependent on calcium to form the plaque.
Okay.
Part of it, but there's really no way of telling who's going to form it or who's not. It happens randomly throughout different people's lives. About 10% of men will have it at some point. And it all of a sudden presents with a bend in the penis, usually when you have an erection.
Yeah.
And that can be left, right, back, at your face. There's several different ways that it presents, and it can happen anywhere within the length of the penis.
Yeah. So, disclaimer. So, folks, anyhow, if you just happen to randomly find this discussion, we're going to get into this in all the gory details. So, if you don't want to hear about this type of stuff, then you might just want to click away because we're not going to hold back. So, for example, like my guy, let's just pretend that my guy is like the upper stage of the Falcon 1. See that right there flying through space? With the astronauts up here and this part here. See how nice and straight it is, and it flies real good.
Engine full power, and liftoff. Go active 3.
Well, that used to be my guy until on this fateful day when somehow it went from this to kabam! A rather sharp bend kind of near the crew capsule. And I was like, Then I had to go do some research and figure out what it was about. And it took me, and that was about a year ago. So it took me nearly 9 months to finally get up the courage to actually do something about it. So, and I read about how, there was, luckily, the good thing for me was that apparently it can bend in any direction, right?
That's correct.
So it could have gone like this. It could have gone sideways. But for me, it went up, which can be kind of good. But for my taste, like that's too sharp of a bend, even if it's might be supposedly a good thing. So I'm like, well, you know what? Let's just see what we can do. And I haven't tried. Once I did a little bit of research on the internet and discovered that, like you said, it's just a bunch of scar tissue. I was like, I started feeling around in there, and I'm like, okay, so I can kind of feel where this scar tissue is. So then I tried various approaches. We're like, well, maybe if I just like massage it really vigorously over time, I can just break it up myself and it'll go away. And so I tried that for a month or two. And I sort of thought maybe it was doing a little bit, but actually it didn't really do much. So then luckily my main doctor, who is an associate of Mickey, works at the same medical facility, said that they actually have a treatment for it there. So then I finally thought about it for another couple of months. And then I said, you know what, I'm just going to go for it. Let's see what we can do. So here we are.
I got to say, it's the hardest step too, is actually reaching out to a doctor. A lot of guys put it off
Right.
because they're embarrassed to talk about it, or they're afraid to talk about it. They think there's something wrong with them, and it's completely normal. It happens.
Yeah. And then, like we said, it's like happens about 10% of guys. And and I think it's pretty much some kind of, it's not like it just magically shows up. It's usually like it's a result of an injury, right?
A lot of times it's a result of an injury. Oftentimes it's not. All of a sudden it just starts to develop. Many times it is an injury that sets it off, but it doesn't have to be.
Oh, okay. I didn't know that.
And there are varying degrees too. I mean, it can be, like you said, a smaller bend. And I've seen cases where it's a 90-degree bend directly back in your face.
Wow. Well, happily it didn't hit me that bad. But even so, and the other thing that happens, which is rather annoying, is that not only do you get the bend like this, but also because it's pulling back all this tissue, it also reduces the length. So, you know, if you're a guy like me that's rather medium-ish, every inch counts. So I'm like, darn it, you know? So anyway, so luckily we do have some solutions to this that we're going to get into. So maybe we should discuss what the remedies were for such a thing.
Absolutely. So there's actually a lot that goes into it. First and foremost, it's not just about the physical tissue.
Okay.
There's a lot of hormone involvement. So it's very important that when we're doing the treatment that we get all of your micronutrients and your hormone levels, specifically your testosterone levels, where they need to be.
Right.
It's very important to erectile function in general.
Mm-hmm.
In addition to that, we have to do something to take care of the plaque that's actually creating the bend in the penis. And like you said, sometimes the bend is a good thing. A bend is not always a bad thing.
Right.
Ask any woman you know that, and they'll say, nope, a little bit of bend is good.
Which is, And so in my case, what we decided to do is we never really got back to this. But now what we have is kind of a gentle glide. Well, not that gentle, but kind of like an F-18 taking off from an aircraft carrier.
Right.
And I'm like, okay, I can live with that. So,
we call it the G-spot special.
Right.
That's what that is. So in addition to that, part of the treatment is helping to remodel the erectile tissue and get rid of the plaque. There's a couple of ways that we work on doing that. One is we bring in a shockwave treatment. Shockwave is designed to go in, and if you have the plaque here that's formed very tightly and adhered this way, it sort of breaks that tissue up so that it can start to remodel. And in breaking the tissue up, when we use the shockwave, it actually opens up some of the capillaries and brings in various cells to clean out the debris and remodel the tissue. In order to support that, we incorporate what are called Priapus shots. They're P shots, which is essentially a PRP shot that goes directly into the penis, more specifically into the plaque itself, so that we can bring a needle in and sort of break open and separate that plaque.
Okay. So first off, the first part is the shockwave. So you're blasting it with your ultrasonic waves, right?
It's a focal shockwave, yes.
Right. So I get to go in there, and me and Mickey have gone through this several times, and you get numbed up, right? So that right off the bat, that's not really that fun because you're getting poked right in your man part. But then he takes this gun, like here's our little spaceship, right? And then he takes this little shockwave gun like this, and starts blasting it. And the first time we did it, I was like, well, let's just try it without the painkillers and just see if I can handle it. And then what did you tell me right off the bat?
I said, okay. I said, every guy says that. The first time they get you, like, oh, I can handle it. I'm a guy. Until the second they feel it, and they say, whoa, okay, give me the shots.
Right. And so what it is, so he's going like this, and it sounds kind of like, and he's literally holding this gun thing that looks a bit like a phaser. And it's connected to this giant machine that sends the shock waves. And so now I had kidney stones a couple of times. So I was like, you know what, I can take this. I can handle this. Can't be anything worse than kidney stones. Well, the thing is that every time it goes like that, every one of those feels like a red hot poker right there in your man parts. And the thing is that when it hits the plaque and it's doing the best good is when it hurts the most. And so it kind of comes and goes. It's a bit like getting your teeth drilled at the dentist where, like, you know, they're drilling in your tooth and then they hit a sensitive spot and then it really hurts and then they back off and then you don't feel like that's kind of what it's like. So we're going along in the different areas. And I remember the last time we did it, I remember what I said to you. I said, well, just do it full blast. And if I start swearing at you, that's fine. Just as long as I don't hit you.
yeah, that's it. You were white knuckling, is what I called it. Yeah. So,
and I had a special little technique where I take my thumbnail and dig it into my first finger right here as hard as I can, so that sort of distracts the pain. But still, I mean, how long did it last? Like 3 minutes, 2 or 3 minutes?
So it depends. We use 2 different shockwave devices. So we'll do the lidocaine nerve block, and then I use the focal shockwave, which is a curve more like this that goes deeper into the tissue to sort of help promote the numbing of the lidocaine. Then I go back with a linear shockwave, which is the jackhammer, as I call it. It has a ceramic head.
This one.
And it's more like pop, 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 and you get 4,000 cycles of that over the plaque itself.
Yeah.
The higher we turn up what we call the bars, like the intensity of it, the better the treatment is. So it breaks it up more.
Right.
But each round takes about 2 minutes. So it's about a 4-minute treatment, 3 to 4 minutes.
Okay. So 4 minutes of pain.
Of torture.
Yeah. So, and we had to do that, I don't know, 6 times in the first round. Mm-hmm. Then we ran into a bit of an issue that we're going to talk about later that caused me to have to do some more. But okay, so we did 2 of those for 2 days where all I got was the shock wave and all the different, and it was mostly like right along the top, and then right there was most of the stuff, right?
Correct.
Yeah. So then you sent me home with a couple of devices that I had to use, right?
Correct.
So
there's 2 devices. So once we break up the material.
Oh wait, I'm sorry. What we had to do then, we did the PRP.
Correct.
Right, which is where we do the shock waves, and then what we do is we extract blood from my arm. Right.
Correct.
How did we do that? Maybe we should describe that.
So it's basically we draw 120 milliliters, and really it's about 100 milliliters of your blood because we have 20 milliliters of an anticoagulant in there to keep the blood from clotting up. And we spin it down, we pull off the plasma layer and part of the buffy coat that has platelets in it. Once we get that off, we spin it again and we get all the platelets to settle to the bottom. And then we take all but about 10 milliliters of that out and concentrate it down to about a 10 to a 12x concentration of platelets.
Okay.
With those platelets in that plasma, it's called platelet-rich plasma.
Okay.
We then mix it up and activate it with calcium chloride to open up the platelets and release what are called growth factors. It's those growth factors that are in that platelet-rich plasma that do most of the work.
Oh.
So here we do 2 rounds of just the shockwave to help break. On the 3rd round, we do the shockwave, and then we do the actual PRP shots directly into the plaque.
Right, and that was the 3rd day, and there was a couple days in between each round.
Correct.
So, so by the time you're ready to inject the stuff in, it doesn't look like blood anymore. It's just kind of a clearish pink,
like an amber-colored.
Yeah.
Hero. Yes, correct.
And so the fun part about that is not only are you going to get poked all along. Here, wait a minute. I'll use my baton. So they take the needle and then they poke it all along here, and you have to kind of ram it in pretty good because of the plaque, right?
Correct.
You have to really do it like this, all along there and then all along there. So I don't particularly like needles that much, so just the fact I'm getting poked that many times was not that fun. But the other thing is that it just so happens that the platelets, which are the things in your blood that cause your blood to clot, sting like hell. So, like you were telling me, like when you're a kid and you skin your knee, it's not really the wound of your knee that really hurts so bad. What makes it really sting and hurt bad is all the platelets rushing to your skin knee to stop the bleeding. Right?
That's a huge part of it, yeah.
Yeah. So anyways, so now you're getting poked, then your entire spaceship is getting filled up with these platelets that sting, and even though you are numbed up, you can still feel the sting. And then when the numbing agent goes away, then you keep feeling the sting for. One time I felt it for several days. So we're putting that in. So those are kind of like the repairmen, right? The platelets.
Yes, that is what's doing a lot of the work. It's the actual growth factors inside of the platelets.
Right. So we broke it up with the phaser. Then we poke in the nanobots, let's call them, inject them in. And the thing is that they get kind of injected sort of deep into the spaceship, but we really want them to get back out to the surface, right?
Yeah, so not exactly. What's happening is if this is the hole of the penis here, this is the hole of the penis, the plaque is usually more towards the surface.
Right.
So when we're going in, we're actually purposely injecting directly into the plaque. So It's actually not as deep as you might think. It's maybe 1 millimeter to 2 millimeters into the actual tissue.
Okay.
It depends on the plaque and where it is. It sounds sort of like Rice Krispies.
I remember hearing that.
Crackle pop.
Because that's where you have to really poke it in with a pretty good force, get through it.
That's right, because the plaque is hard. So you have to get it in there. And then as you inject, you can hear it cracking as it breaks open and separates. And that's what we're going for.
Yeah. Thus entereth the penis pump.
That's right.
Okay.
So
here's the first thing that I got to take home. Ta-da. Now, what this is if this is a spaceship, then this is like the space station that the spaceship has to go in. So let's put the spaceship in the space station. Because the point of this is mostly to draw all that PRP stuff to the surface, right?
It's to spread it out throughout all of the tissue, correct?
Okay, so we're putting the spaceship in the space station.
Your space station is looking a little cloudy there, man. You might need to clean it.
Yeah, it's had a lot of use. So okay. All right. The spaceship is in the space station like this, right? I notice we have a little seal down here. And yeah, all right. So then once it's in like that, oh no, because if it doesn't seal right, it won't work. But then what you do is you turn it on. And can you hear that sound? Zzz. It's a rather pleasant sound after a while, once you get used to it. And then it just starts creating a vacuum and this one has 4 different settings. So depending on how good of a seal you get down here, and the reason why it gets cloudy is because there's a special gel that they give you that you're supposed to put on the spaceship to help it seal right here in the little airlock, and also make it easier to get out of the airlock after you're done. So anyhow, so we get this. Mine has a setting of 1 to 4, and depending on how good the seal is, sometimes you only need to get it to about 2, and it'll still get a good amount of vacuum, because it tells you how much negative millibars it gives you. And the way I did it, I tried to get it to at least 100. So basically, it creates a vacuum in here, and then you're supposed to keep the spaceship in the space station once a day for 10 minutes a day. Right. Yep. And then that vacuum effect draws the blood into the spaceship, and then helps all the PRP stuff get to the surface, right?
Yes, it actually does a couple of things.
Okay.
It does spread out the PRP to make sure that it's getting through all of the tissue.
All right.
But it also brings back a little bit of that length and girth that you lost with the Peyronies in the first place.
Right. We did get a bit of length back. We have another device we're going to show after this. Correct. That does more of that type of stuff. Right. One thing though is what I didn't expect was that it actually makes the spaceship a lot wider. In other words, increases the girth.
Correct.
But unfortunately, most of that's just kind of temporary.
Very temporary.
But when you first notice it, you're like, whoa. Okay, I can sign up for this. So, but then of course, it didn't last. It was temporary. So anyway, so this wasn't too bad, doing this once you get used to this routine. But then I had another homework assignment, which was to use this character. Which is called a RestoreX.
RestoreX is the next generation penile traction therapy device developed by Pathright Medical in cooperation with Mayo Clinic. It is easy to use in 3 simple steps: secure, extend, and rotate. Before starting, take a moment to familiarize yourself with RestoreX.
I have the box for it right here. See that? See how happy that couple is?
Just thinking that. They look very happy.
We're assuming that they're married and that their marriage has been significantly improved by this wonderful product.
Yes.
Known as RestoreX, and it's also by Pathright Medical. So, RestoreX, Pathright, all the good things that they could possibly be. So, yeah. So I refer this. I told my friends all about this, so I kept them all. They all got blow by blow descriptions of how this is all going. So when I talk about using this is my man torture device because it's sort of putting yourself. What it does is you get the spaceship. Okay, hold on. Come out of there. Okay, here you go. You get the spaceship into here, right through there. Whoops, go that way. And then, right in the crew compartment, you clamp down on it like this. Now, this won't actually do it because it sort of smashes it down and flattens it. Enough so that it's going to click right there. And then, now what I did, actually, I should show you this too, is so as not to be subjected to too much pain up there in the crew compartment. Because it's hard to see, but there's some grabby sort of knurling stuff here that's supposed to grab on it, but doesn't really work very well. So what they recommend is they give you this stuff, which is just plain old gauze. And then the way that I did it was I just sort of wrapped it around the crew compartment like this. Of course not. Yeah. Okay. Sorry, folks. You wrap it around the crew compartment. So you've got some protective gauze on there, like that. Can you see that? And then you put it in the little clampy part. So then what you do is you start doing this so that it starts extending. And you extend it out, it has little clicks. So you extend it out about as much as you can handle. Now, we're going to talk about this in a sec. But don't do it too much. Don't be like me and do it too much because bad things could happen. Then, once you get it out about like that, then it has a thing here where it can tilt now up or down, or I think there's a way to get it to do it sideways too, but I never did it. So for me, since my spaceship was bent up like that, we had to bend it the other way as much as it can go, and it has little clicks here, so it'll click to do an anti-bend. And then you just, once you get it to as much as you think you should be doing it, then you let it sit there I used to let it sit for like 15 minutes, something like that. So, yeah. So I would just say that putting the spaceship in the space station really is not that bad. But then the medieval torture of the spaceship, this device, actually takes a lot of getting used to. So you have to sort of work yourself up to it. So, but there are some downfalls to that. Because I'm sure you told me not to stretch it too far, and I watched the video and they said don't stretch it too far, and it says in the instructions don't stretch it too far. But guess what I did?
You got overzealous.
I stretched it too far. So guess what happened? We were all good like for 6 rounds, and then one day I started getting too over whatever with this thing, and I was really cranking on it as far as it would go so I could really feel the stretch, and then I'm like, okay, and then I'll try to do one more notch past that. And so I did that, and then what do you know, a day or two later I'm like, seems like some new scar tissue just showed up on our spaceship. And what do you know? It did. And I realized almost instantly, because it was right down here. There was like this one vein on our spaceship that suddenly was really hard, had all this scar tissue in it. And I was like, that was kind of where I felt the stretch. And then right up here, right where right up here by the crew thing, I was like, there's an entire ring of scar tissue up there. And I was like, well, that was where the thing bent, where I overstretched it there. So now I'm like, I think we got to do a few more sessions. So that was the last thing we did. Now, the thing was, I don't know if that new scar tissue contributed. It didn't seem like it contributed to any more bending. But I figured we should probably get rid of it, because the stuff near the crew compartment was a lot of scar tissue. Like, you could really feel it. Like, it was like a ring all the way around, really, and really quite thick.
Yeah.
So guys, don't do that. Don't do what I did.
Yeah.
Don't do too many clicks on the medieval dick torture device. Just do a reasonable amount and call it good. Otherwise, you'll be sorry, and then you'll have to go do more of this kind of stuff, and so on. So, yeah. So then I decided after that, okay, I'm done with this. I'm not even going to use that anymore. So for the last few, I just stayed with the space station and called it good. And then happily, oh, we forgot to mention there was another thing you have to do. There was that ointment that you got me.
Yeah, it's a calcium channel blocker, because remember I said calcium has a lot to do with the formation of the plaque.
Mm-hmm.
So we use a twice a day cream that you rub into the penis that helps block the calcium channels to prevent more plaque, and it actually helps break up the plaque that's currently there. So
you just rub it in, and then it goes through the skin and gets right into the plaque. And so I had to keep doing that. In fact, I'm still doing that as a follow-up, because I've got some left, and I'm supposed to still do the pump for another 3 weeks, I think.
Yep.
Right. Even though by now we're pretty happy. So anyways, that extra scar tissue that I got is pretty well gone now. Especially the ring up at the tip is all gone. And it's a tiny bit, but it's not really. I think it's fine. It doesn't hurt or anything like that, and doesn't seem to affect anything else. So I think we're all right.
We really got in there on the
and that was fun.
Yeah.
So that was the one where I said, if I if I punch you, it's too hard. Hurts too bad, because that was the treatment that hurt the most.
Sure it was.
And then you said, if you punch me, I'll punch you back. So luckily we didn't get to that point. I think I swore a bit. I'm pretty sure I swore. As a
rule of thumb, it's never a good idea to punch a guy who's holding your penis in his hand.
Yeah. So, yeah. Anyway, so now we can live all happily ever after. And now I'm just in the couple more weeks of the space station. So on. So now I want to ask you, as you told me that you were quite a successful actor in your previous life, right?
I was a professional actor for many years, yes.
Yeah. Would you mind telling us a little bit about how you transitioned from being an actor to being a man doctor?
Well, I was actually very fortunate with acting, that I was supporting myself in a lot of ways with acting. Traveling around the world, doing a lot of theater. And unfortunately, I developed multiple sclerosis.
Oh.
And I was actually relapsing 2 to 3 times a year. I was on a crutch, or I had a cane, and complete spasticity, no gait balance, the works. I couldn't drive a car. I was told I'd never walk right again.
Wow.
And it got bad enough that I couldn't really do acting the same way anymore.
Okay.
and it pulled me out of it. And it got to a point where I tried many drugs and different things that weren't helping, and I was just getting worse and worse. So I eventually dropped my neurologist. I dropped the drugs, and I started focusing on the stress and my diet. I changed all of those things dramatically. And within 6 months, every symptom ended up going away.
Oh, wow. What a great story.
For about 13 years now, I've had no relapses, no symptoms at all, no drugs, and I can rock climb at a very high level now.
Oh,
Uh,
wow.
so all of the symptoms have been completely reversed. And an MRI I had a few years ago showed that most of the lesions in my brain were also repaired through other supplementation and things that I was doing. Um,
Wow.
something that, I'm happy to talk about more at length with patients in office, especially if they're going through autoimmune things. But that's what got me into medicine, specifically naturopathic medicine,
Okay.
is I wanted to help people find a better way.
Wow. Okay. How interesting. Wow. So you became a naturopath. So, and then
Right.
how did you end up going in just dealing with men's issues?
Dumb luck. It was it was absolutely dumb luck. The residency that I got through SageMed in Bellevue, Washington,
Uh-huh. Which is where I
um,
go. Yeah.
focused a lot on hormone management, men's health, particularly with erectile dysfunction, Peyronie's, things like that.
Hmm.
Um, and it just sort of, I enjoy doing it very much. It was very gratifying to sort of give that back to other people.
Huh.
Uh, because the treatments that we put you through were not exclusively for Peyronie's. In your case, it was Peyronie's.
Right.
We also use those treatments for erectile dysfunction. And
Right.
we've taken men with no function and given them full on erectile use again.
Wow. Oh, that's cool. So that was the one. So there was actually two machines. We sort of talked about it a
Correct.
little bit. There was the one that actually doesn't really hurt. It just kind of goes boom, 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 boom.
That's a
That
focal
was the
shot
one,
image.
right? You gave me that too, because you're like,
Yes.
well, do you want to have this while we're at it? And I'm like, sure, why not? You know, and that's the one that's supposed to help the blood flow, right?
It does. It helps remodel the erectile tissue so that it has better integrity and holds the blood better. But we
Okay.
also treat the pudendal artery so that you get better blood flow to the penis.
Uh-huh.
We combine that with, again, optimizing hormones.
Uh-huh.
And we usually give a low dose tadalafil, which is Cialis, to
Okay.
help increase the amount of nitric oxide that's staying in the erectile tissue, so that you can get firmer, longer lasting, better erections.
Huh.
It also increases a little bit of size and girth, but sensitivity as well. So you're more sensitive. So it feels better.
Right.
Yeah. And it always goes in, like you said, treatments of 6. So it's 2 rounds of 3.
Mm-hmm.
Third treatment, you get the PRP shots, and then you use the pump for 1 month, and then you come back and you do 3 more rounds and get another PRP shot or series of shots, and then you use the pump again for a month, and then we reassess.
Oh, so the PRP, so in that situation, the PRP rounds is for just, so that's not breaking up plaque, that's just,
Nope, it goes directly into the what's called the corpus cavernosum that runs in the penis, and it goes into that tissue, which is what holds the blood. And then it
okay.
also goes into the head of the penis, the glands, which is also erectile tissue. And we inject directly into that. And in that case, the pump actually spreads that PRP out through the entire length of the penis,
Mm-hmm.
so that you get maximum benefit.
Okay, and the theory is that the PRP just sort of helps expand the tissues?
It helps remodel the tissue so that it has better integrity and holds blood better and works better. The function is better with it.
Okay.
And there's a lot of research behind that.
Oh, okay. Well, if I ever start having problems with that, I might come back then.
Yeah, I do a lot of treatments.
Yeah.
I do a lot of patients for erectile dysfunction as well.
Yeah. Well, guys in our 50s, these things do happen. So
Maybe just 50s, man. You'd be amazed. There's guys in their 20s that I treat.
wow. So from your point of view, is it mostly physical or is it partly psychological?
It's usually one of a few things. It's either psychological,
Huh.
physical or chemical, like the hormones aren't right.
Mm.
There's something in your brain that just takes away your ability to have erections. Maybe it's past trauma, whatever it is.
Mm.
Or it could just be, a lot of times it's the physical damage. These treatments directly repair a lot of the physical integrity.
Right.
And then, the tadalafil helps with some of the chemical aspect of it.
Okay. Yeah, I can see how like once it started happening to you, then it could easily be psychological. Like every time you think it's going to happen, then right then already that reduces suddenly you're getting scared, and then now you're not really turned on anymore, and so then it sort of does a downward spiral.
100%. And there's some guys that just like, for whatever reason, put having sex with someone else like on this pedestal that they just can't get to. And so it's all here, and they just can't.
At that point.
Mm-hmm. So there's a lot that goes into it, but that's part of what I do. I'm the nickname you gave me.
No, I can't even remember when I gave you a couple.
You gave me Mick the Dick Doc.
Oh yeah, the Dick Doctor.
Yeah. I probably shouldn't have said that.
I shouldn't have said that.
Hagrid.
I should not have said that.
Yeah. So, is there some element of just the mental part that's also part of the treatment, or like how to?
I think a lot of the mental part that gets fixed is when you actually start seeing results from the physical treatments themselves.
Okay.
It sort of helps with the mental picture, because a lot of times that mental picture starts because someone has a little bit of an issue where they can't quite get a firm erection like they used to, or they can't last until ejaculation. And because of that, they start to have problems here that make it worse and worse and worse. So when you start doing the treatments and all of a sudden you start to get some of that back, you add in a little bit of tadalafil and you wake up with some morning wood, this starts to get better. And it builds confidence, and it actually gives you all the tools you need to actually be confident. I feel like I've saved quite a few marriages and relationships with these treatments.
Now, do you find the guys, I guess we're getting into this now, so do the guys typically just come by themselves, or do they bring their wife too?
I've seen both, actually.
Okay.
It's more often than not guys come in by themselves because guys don't like talking about this.
Right.
But it's like I say, you could line up 10 guys, all with broken legs, and they'll be like, I'm fine. The second their dick doesn't work, they're like, Doc, I need some help. and that's what we do. Yeah.
Give me some pills, man.
We do something.
Yeah. Yeah, that's wild. Well, it's one of those taboo things that we don't like to talk about till now.
I think it's so important, though, because for a lot of men, and I think a lot of men resonate with this, that a lot of what we identify as a person is our sexual ability. Yeah. Guys think about this all the time. It's like every so many seconds we think about that. And so when there's something on there, it really takes a huge piece of who you are away. And fixing that has been, again, it's been a very gratifying thing for me. I really enjoy it. I never thought I would say that, but I enjoy doing this very much.
That's cool. And do you find like, do the guys open up once they've had a few sessions with you and they can kind of chill out and talk about it, or?
Absolutely. The hardest session is showing up to talk about it in the first place.
Right.
The very first treatment. Right. When you actually have to pull your pants down and let another person actually grab you and do a treatment on you.
Yeah.
Once you get past that, it's all easy sailing.
Yeah, it's kind of surreal. I mean, it's still surreal. The best one was the day when I had both you and Sage, and then also I had a female doctor in there too. And then I said, well, whatever,
It's true.
At this point, it's like, and then And then I realized, well, okay, if men can be gynecologists, then women can be dick doctors. So, but I was trying to be cool about it. I mean, I was even just, well, I was sort of freely talking about it in the lobby, even with the reception people they were doing the reception. I didn't try to, everybody knew why I was there. So I was, whatever. I'm like, whatever, it's a medical thing. So, but I'm sure you have lots of patients that weren't quite as open about it.
No, but one of the things we really pride ourselves on there is creating a very safe space.
Right.
Like we don't make anyone feel bad about talking about it.
Right.
We're there to support you and improve your life, and that's what we do.
Yeah. Yeah. Well, I think you guys do a really good job. So, onward and upwards.
We're not as upwards and more like
not so much of a, but more of a smooth kind of airplane taking off.
There you go.
So, well, is there anything else we want to hit before we wrap up?
No. If anyone is interested in talking more about these treatments, they can always reach out to me. I don't know how you want to do that in terms of getting my information. They can shoot me an email, or they can call the clinic to set up a free consultation if they want to talk about either erectile dysfunction or Peyronie's.
Right.
And I'm happy to do that with them.
Okay. And you also do testosterone treatments too, right?
We do a lot of hormone treatment for both men and women, which includes, obviously thyroid stuff, but testosterone, estradiol, progesterone. I manage a lot of that.
Right. Yeah. And so in my case, since my testosterone was pretty low, it was still within the normal range, but at the really low end of it.
Correct.
So for us, we decided to boost it, at least for as long as we were doing the treatment for the Peyronie's. I can't even say it right.
Peyronie's, you got it.
Right. So that way it would help heal. And and then the way that you guys do is a little bit it's kind of different than most approaches, right? You do the pellets. Is that common now, or?
Pellets are becoming more common. We do various treatments. Do a lot of injectable testosterone as well.
Okay.
As well as pellets. I don't like the creams for testosterone for a lot of reasons.
Okay.
But for estrogens, we also do the full Wiley protocol for women if they want, but we do pellets for women, both testosterone and estradiol.
Okay.
And then progesterone is always a pill.
Okay, so what I did is the pellets, and that was where you have basically they're just crystallized testosterone, right? Is that all they are?
Pure testosterone that's crystallized and compressed into a pellet that goes directly in the fatty layer of the butt.
Right. So I got it. So right on my, I forget which one. I guess that's good. One of my buttocks, we put like 8 pellets in.
Correct.
Several months ago. Yeah. And that hurt for about a week or two.
It's usually about 7 to 10 days that it's sore, but it's not like unbearable pain. It's just
not unbearable. It's just a pain in the rear.
That's it.
Yeah.
Pain in the butt.
Yeah.
Got it.
And so that technique, that goes in the fatty tissue, and then you were telling me that the beauty of that version is that as your blood flow increases and decreases, like with exercise and stuff, it causes the amount of testosterone to go into your bloodstream to increase or decrease as needed.
Correct. And that's more what your gonads actually do in real life. So it mimics more what your normal hormone responses would be to exercise and rest.
Right. So, and usually a person will feel an increase in energy and mental alertness and stuff like that, right?
Yeah, it increases mood, focus, energy, libido goes up. But on the other side, there's a lot of misconceptions about testosterone.
Okay.
People, it leads to stroke. That's not true. We monitor very closely when we're giving people testosterone to make sure that their blood is not getting too thick. Okay. It actually reduces osteoporosis risk, cardiovascular and stroke risk, dementia risk, while increasing like lean muscle mass, and increasing, like I said, focus, mood, energy, libido. All good things. I personally think that almost everyone at a certain age will need to be on testosterone and should be. Because when you hit 40, most guys can attest to this, you hit what's called andropause, where your testosterone levels start to really drop and drop quickly. And some doctors would say, oh, that's normal. Sure, but it's not optimal. And you certainly feel better when we get your testosterone levels back up.
Yeah. The weird thing with me is that I never really felt, well, I actually felt like my energy level was pretty good already. And then I didn't feel really an improvement in that when I did the shots or the pellets. But I think that's also because, I mean, there's a supplement I take every day. I take this supplement called AG1, Athletic Greens 1, that it's got all kinds of nutrients and vitamins and stuff in it. And I think it has some green tea in it too or something. But whatever, everybody who drinks this stuff feels energized. They feel revitalized and their energy level goes up. And so I think it's because I was taking that already. That's why I didn't feel that bad to begin with. And then I didn't feel much different once my testosterone went up. So
it's possible. It's sort of like if you're drinking energy drinks every day and you feel like you have a lot of energy.
Yeah.
This is putting testosterone in and now you actually do have energy.
Yeah.
And you don't even need those energy drinks.
Yeah, it's not really an energy drink. Like, it's not like caffeine.
Well, no,
it's really a whole bunch of I would call it a nutrient supplement because it's got a jillion types of vitamins and minerals in it. And anyway, yeah. So, all right. Well, I think we're about ready to wrap up, unless there's anything else we want to touch on. We touch on all the different types of man issues besides having the bent dick.
That's right. You don't
so for me, okay, here's one. So what should I do besides not being abducted by aliens again to prevent getting it re-injured or re-bent?
Well, I mean, for one thing, don't overuse your RestoreX device.
Yeah, how about I won't use it at all anymore?
Yeah. The thing is, though, the best thing you can do is optimizing your nutrition.
Okay.
Eating a lot of veggies, fruits, good proteins, limiting sugars, alcohol, things like that. Getting good exercise. Those are the best things you can do just in terms of supporting your body to prevent things like that from happening.
Mm-hmm.
The problem with Peyronie's is there isn't really a rhyme or reason as to who or why someone gets the plaque. It just happens. Once you have it, yep. And if you've had it before, you could be prone to getting it again. But the best thing you can do is optimizing your nutrition and exercise.
Okay.
Get good sleep. Sleep being, there's a lot of things that go into sleep, but staying hydrated as well. And these are all things that we work with people on a daily basis. When I see someone as a primary care physician, I work on optimizing all of that to keep you off of needing drugs down the road. And in a lot of cases, if you're on drugs, I can get you off of those drugs because you don't need them anymore. Mm-hmm. And that not always. Sometimes you need a drug and that's okay.
Yeah, like I've been on the naturopath thing for decades now.
Sure.
But I do have to take lisinopril.
Sure.
For high blood pressure. I'm on that. And but that's the only real actual drug I have to take. And of course I do supplements and stuff, but yeah.
And sometimes you need a drug.
Yeah.
And we prescribe the drugs as well. Like I do all of that. I manage a lot of drugs for patients.
Yeah.
But the question is, what are you doing outside of those drugs to support your body to have the best possible outcomes and have good longevity of life where you actually enjoy your life into your 80s and 90s? You can do that.
Yeah.
But it means making a lot of changes and really putting the work in now.
Okay.
So that's what I do. I think of myself as an advocate to walk beside someone and help them along the way.
Yeah. Yeah, that sounds good. And this plaque only shows up Like in your penis? Like, will it show up anywhere else in your body too?
Plaques form in other places. Peyronie specifically is a very thick, heavy plaque that really is specific to the penis.
Okay.
Because you felt it. It's a very
Yeah.
thick and dense
You can
plaque.
feel it. Yeah.
Form. It's very thick, and it's thick enough that it actually changes the shape and the integrity of the penis.
Right.
So if you're prone to plaque other places, it's reasonable to think that you might form plaque in the penis as well. But again, optimizing nutrition, exercise, hydration, sleep, all of these things help reduce the risk of that.
Right. Maybe throw some meditation in there and a
Correct.
prayer. And yeah.
Whatever you need, like spiritually, it is really important that you find an outlet that actually resonates with you. It's very important. There's so many working parts that go into it. And that's sort of what naturopaths do, is we work with the whole person.
Right.
We're not someone that you're going to come in and be like, hey, I have this thing, and we write you a prescription, slap you on the butt and say, all right, have a good one.
Yeah.
We ask you to come back after we write that prescription so that we can figure out why you needed it in the first place.
Right. Yeah, it's a much better holistic all body approach. But it seems like the family doctor of the olden days was kind of like that, where they had a better grip on the whole patient,
Yeah, things definitely changed at some point. I feel like you're right.
Yeah.
And we sort of lost it. But it also used to be 100 years ago, every single household, like whoever did the shopping, if it was the mom or the dad, whoever it was that did the shopping, could go into a grocery store and pick foods to heal different issues. Like they'd say, hey, these herbs will make this condition better. And that used to be common knowledge.
Okay.
And we've sort of stepped away from that. And now it's like, what pill can I take?
Right.
Fix this. A big one's like, with weight loss right now, semaglutide's kind of all the rage. And people forget about diet and exercise.
Yeah.
But anyway, that's
yeah. Okay. Well, we're back in our spaceship, and may we continue through our life all happy and functioning well, so it can get us to our goal, whatever that might be. Now, do you know something about Star Trek, right?
I do.
Do you know the Vulcan salute? Live long and prosper.
Sorry, my fingers were.
There we go. I always do that with my guests at the end of the show, and I say, live long and prosper, my friend. And may you continue to keep us on the straight and true path of righteousness and all those good things that us guys need.
Pranakasha Production. Fantastic creations emerging spontaneously from the space of life.
For the benefit of all beings everywhere.
We gotta